Welcome to the WealthStack podcast. I'm your host, Shannon Rosic, the director of WealthStack Content and Solutions. I'm joined by Christine Simone, co-founder and CEO of Caribou. Today's topic, understanding the intersection of healthcare and finance. And we'll unpack exactly what that all means here in a little bit. But Christine, just wanted to say thank you for coming on. This is long overdue.
Of course, Shannon. I'm so happy to be here. Glad we finally got it on the calendar.
Yes, agreed. And before we dive into the first segment, I actually want to start with your background. And I always joke that this is going to be the hardest question you'll probably get this entire episode. But I want to dive into what makes Christine, well, ultimately Christine, and what led to you founding Caribou.
Yeah, probably my background is very different than most people you might have on this podcast who dreamed of being a wealth manager or always worked within financial services, because I knew nothing about this industry before starting Caribou, actually, because my whole background is on the healthcare side. Went to school thinking I would be a doctor, was pre-med, almost, did a master's in neuroscience and physiology, and then realized I wanted to be on the innovation side of the healthcare system. But what I very quickly learned working within medical device companies, digital health companies, was that no one on the healthcare side is incentivized to help people make smarter financial healthcare decisions. And that was really the impetus of starting Caribou. It's that you go to your doctor, they don't know what certain services are going to cost you, right? You go to your insurance company, they're not incentivized to help you potentially save money because it's less dollars in their pockets. So how can we take the same fiduciary angle that advisors take, but apply it to making smarter healthcare decisions, is kind of what we wanted to create when it came to founding Caribou. And we didn't really know what that was going to be in terms of a product or a deliverable, and how we were really going to convince advisors that they need to be having healthcare related conversations with their clients. But through a lot of just customer discovery, as they call it, understanding the workflow of advisors, understanding the gaps that they had in their financial plan and how they want to do better in this area, but maybe don't have the right tools and resources at their disposal to do that, built Caribou. So the past 4 years have been a roller coaster, to say the least, kind of learning about the industry at the same time of really building out the product and convincing advisors that they need to be incorporating this into their financial plan. So that's really what drives me, is breaking down the incentive structure that exists within the healthcare system and taking that fiduciary angle that advisors have and applying it to that industry.
Love it. And we'll certainly dive into the platform here in a little bit, but I have to ask about the name Caribou. As an obsessive animal lover myself, I think the name is phenomenal, but I'm sure there's a deeper meaning than having just an affinity for mammals in the deer family, right?
Yeah, you're a horse person, I think, right?
Oh,
Right?
yes.
Yeah. Yeah, exactly. So nothing to do with loving the animal, actually, but the caribou, the mammal, travel the furthest of any other land mammal for migrations. So they're known astrologically, and I'm not really a star sign person either, but they're known astrologically to be a guide. So instead of having some generic name like med this or health that and so on, that the idea of that and how we're helping guide clients and advisors through the complexity of the healthcare system really resonated with us.
Well, thank you for indulging me with the background story. I appreciate it. And really, before we dive into the meat of the conversation, set the stage a little bit here. Can you just define what exactly healthcare planning is?
Yeah, such a good question, because it's not as well defined as estate or tax planning is, right? You could probably say that those types of offerings are maybe table stakes, very common. Maybe half the industry roughly is doing estate and tax planning. A fraction of the industry is doing health planning, and probably even less so is doing it in the way in which we would define it. So our definition is that it's a comprehensive review and optimization of clients' present and future healthcare costs based off their personalized needs and budget, which is a mouthful, but there's a lot of let me just break down that sentence for you in a few ways. So reviewing and optimizing. So it's not a set it and forget it, right? This isn't one number that you plug into your financial plan and then you never revisit it with your clients. This is something that's constantly evolving. You're constantly trying to help your clients save money or better optimize their coverage, better align it with quality or the healthcare needs that they have as they transition through different stages of their life. You're looking at them now And then you're looking at them in the future. So the present and future part of that sentence, you want to make sure that you have the short term and then the long term view. And then you really need to incorporate their individual needs and any potential budget that they have in store for themselves. And this as, their healthcare line item on their financial plan. And that's really where you see the most variability, as one person is not the same as the next. Even within a household, you can have spouses with drastically different needs or drastically different costs. So that's what's really, really important. Healthcare planning is not the estimate that Money Guide or eMoney gives you. That's just estimating your costs and their national averages. They barely take into account anything other than your age, where you live, and your smoking status, really. And it's definitely not something that you only think has a cost savings benefit to it. So a lot of the times advisors will say, well, my clients are high net worth, they don't need healthcare planning, right? Where they're not concerned around what their healthcare costs are. They just want the best quality coverage. That is slightly short-sighted. And I think we'll dive into this maybe a little bit later, but this is really an opportunity to touch on what is potentially the most emotional financial topic that your clients will incur, because your health is your wealth at the end of the day to a lot of people. And it's definitely not something that you outsource to somebody else. So more and more, we're trying to encourage that advisors do bring this in-house. And so to say that you do healthcare planning, it doesn't mean you've got some guy's number written down or a business card on your desk and you say, here, go talk to this person. They're going to help you with your health insurance. That's not healthcare planning, at least not in the way in which we define it.
Well, I certainly appreciate that context. So let's get into the first segment, which I call Stats All, folks. And it's no secret, even as you alluded to, that the healthcare and financial services industries, they're incredibly complicated. And let's be real, they often don't easily talk to one another. And medical bills are actually reported to be the number one cause of US bankruptcies. And I saw a study that claimed it was something like 62% of bankruptcies were caused by medical issues. And another claim that over 2 million people are adversely affected by their medical expenses, especially when they're not prepared or planning for them. And the reality is that in the US, we're really left to our own devices and are on our own because we're just not great about taking care of our aging population, unfortunately. So, what are some of the common challenges people face when planning for these usually unexpected healthcare expenses?
Yeah, well, the unexpected piece is what's critical, right? I mean, there's no crystal ball. Like, you can't predict if I'm going to walk outside, knock on wood, but get hit by a bus later this afternoon, right? Hopefully that does not happen. I should look both ways before crossing the street, but you can't predict some of those things. And so I think that's one of the core challenges that people experience, is that it can be so variable. It could appear very all of a sudden when you're faced with a chronic condition or a new diagnosis, or some type of fee or expense that you didn't expect. But we need to be doing better than that. Like, as advisors, we need to be doing better than that and asking at least some questions that can start to surface whether some of those things might be more common for one client rather than the next. And that's really where the personalization piece comes in. It's slightly uncomfortable probably for a lot of advisors to dive into this, and I understand that and empathize with it, especially if you've never done it before. But this is such a critical part of clients' financial plans. As you said, Shannon, it can completely derail a financial plan if it's not taken into account based off the statistics that exist in the industry around how many people are not prepared for these type of expenses. And so it is to your benefit as an advisor to get personal with clients, to ask them some of these leading questions around, even, do you feel like you have a good idea of what you might spend on healthcare and retirement? You don't have to ask them about their health conditions. You don't have to get into the meat of what medications they're taking if you don't want to, but just ask them, what do you spend on your healthcare? Because then you might uncover that one client has a concierge medicine doctor that they pay 10 grand to every year, whereas the other doesn't. One's got an expensive medication that they pay completely out of pocket for, right? So these are the sorts of things that you can start to uncover by asking some pretty simple questions that hopefully don't feel too uncomfortable to a lot of advisors. But that's also the other piece of what we find is most challenging, is almost, advisors are scared that their clients will say something and then they won't have a response to it. Like, they won't have that expertise and that education. And that's where you can loop in relevant third parties to kind of take it to the next level. But clients really are looking to you to at least start that conversation and to be the ones to be proactive around bringing it up as it relates to their financial plan. Like, you can't talk about a retirement without talking about what are you going to do about your health insurance when you retire and you lose your employee benefits, right? So at least that level of going to that level of depth with clients, we think is really critical to a sound financial plan. But of course, we recognize that advisors, as they transition to be more comprehensive and holistic, are having to develop more and more of an education around healthcare costs, and they can't possibly be the experts. We don't expect them to ever, but they do need to find good resources to at least fill those gaps.
Oh, absolutely. And that was going to be one of my questions to you as well. Are advisors even having these conversations with clients? Because I stumbled across another study that said in 2023, a single person needed around $157,000 saved to cover their healthcare expenses in retirement. And an average retired couple, around 65, needed approximately 315,000 saved. And those numbers are staggering. That's not a small amount, and probably not an amount that people are necessarily accounting for. So how is Caribou positioned to help advisors ultimately have those conversations?
Yeah, well, I hope everyone listening can understand that that's definitely not the number to hold all clients accountable to, right? Like, everybody is going to be so different. And it also depends on, does this client retire at 52 or 62? Or do they work till they're 75, right? Like, that's going to have a significant impact on their healthcare costs. So by no means are those numbers the numbers. They're starting points and maybe, conversation openers with clients around, look, this is what they typically expect us to include in financial plans, but I want to take it a level deeper, right? And that's where Caribou comes in on actually getting to the granularity of, let's look at the health plan options available in your market. That's where everything starts, by the way. So you got to evaluate the health plans available in the market, and you have to look for ones that cover the client's doctors, that cover the client's medications, that take into consideration their income, that take into consideration things like if they have a second home in a different state or travel frequently to see their grandchildren, and maybe they have providers across state lines that they want to be able to visit. So you need to go to that level of depth to really get a good picture of costs. Maybe the client's younger, healthier, maybe they want to put some money into an HSA and contribute to an HSA, right? That's going to impact what they're going to spend because it's going to impact their premiums and their deductibles, those HSA compatible plans. So that is the level of depth that we enable advisors to go to with their clients. And really, it's not just about getting the estimate right, but it's about supporting your client through making what is a very complicated decision. No matter how much money they have, either with you or in general across multiple accounts, clients, even high net worth ones, are worried about this expense, and they're worried about making the right decision. Like, to trust somebody else and outsource this is a potential risk to the financial plan and potential incentives that that person might have. So what we do is we give the advisor a tool where they get to be the ones to drive the whole interaction. You're not outsourcing it to anybody, but we fill in a lot of the gaps of the plan research, locating the plans for the clients, asking any or answering any questions that clients have answered to in regards to the plan. But the advisor is looped in every step of the way so that if there is a conversation about their income and how it relates to their Medicare surcharge, for example, the advisor can actually address that quite easily. These are financial topics that they're accustomed to. But if the client asks us, what does Part A cover versus Part B? I don't expect an advisor to really jump in unless there's someone who's eager and who's really studied up on that and wants to be the one. We definitely would allow them to be that person, but by no means do we expect all of them to. So we've really built a process whereby we bring the offering in-house, but you as the advisor don't need to be the expert. We're there to fill those shoes and really be that trusted healthcare expertise while you are still that trusted financial expertise and the quarterback of the whole process.
So I'd love to hear more about the Caribou platform itself. And obviously you serve advisors, but is there a specific, niche when it comes to advisors that you're serving, and what ultimately makes this platform so unique?
Yeah, so that's one of the things that makes us unique, is that there isn't necessarily a niche. So if you're looking for example, a Medicare tool, there's lots of Medicare brokers out there. There's even a few platforms that can sell your clients' policies. What makes us unique is that we're planning oriented, we're plan agnostic. We don't even sell the health plans because we don't want to be incentivized by any specific carrier or to push your clients one way versus the other. And what that does is it opens us up to be able to support clients in any life stage. That 26-year-old who's aging off their parents' policy to somebody starting a business or losing a job or retiring or turning 65 and aging onto Medicare, we can do it all because we're not worried about Medicare commissions that pay better than marketplace commissions, for example. So that's why you'll find a lot of marketplace related agencies or brokers, but you won't find many that address the pre-65 or early retirees, as we call them. So we work with firms, some that focus on younger client demographics. Like I'm in San Francisco, we work with a number of firms that are focused on tech entrepreneurs in the Bay, right? Those are typically your 30, 40-year-olds who have a long career still ahead of them, but maybe they're selling their business, or maybe they're just starting their business and so they don't have group benefits. We can help with that. Then we work with the working professionals. Maybe you want to help them compare their employer plans or a retiree health package as they're retiring, or if they're going through retirement, they want to compare COBRA to the individual marketplace. We can help with that. And then, of course, everything 65 and above as it relates to Medicare, we can also address that. So there isn't necessarily a niche in terms of client demographic, but definitely the advisors we work with are holistic, comprehensive, planning-oriented firms. And I know that the whole industry is going that way, which is a great thing for us and a good thing for the end client, candidly, to have planning involved in the service offerings and to encourage it. We actually help advisors get more of their investment management clients over to become planning clients, because this is one of the things that can maybe help to transition them over to planning-related offerings.
Well, it's such an interesting time in our industry, especially because we're really seeing a convergence of industries, whether it's between banking, insurance, now healthcare and financial planning. So I'm certainly encouraged that these industries are at least trying to start to talk to each other. But I'm curious, what are some of the tangible benefits for clients and advisor when healthcare planning is brought into the financial plan itself?
Well, more oversight and more control. I think a lot, as you said, the integration of services is becoming more and more important. We're hearing, I think in InvestNet or someone similar did a study that people want 62% of Americans want their financial advice from one person. They don't want that individual for this person for that, and so on and so forth. So if you're bringing this in-house, you have more oversight and you have more control over your client relationships. And the control piece, I think, is critical, because if you're outsourcing this, you don't know what products your clients are going to be recommended. You don't know if they're going to try to sell them a long-term care insurance policy or an annuity or, something else, or tell them to go talk to some other advisor that they know from their personal network, right? So that control piece becomes really important, but it's also a much better client experience. Just knowing that they can come to you and you can do everything, and you can be that go-to for all areas of their finances outside of their investments is one of the core value propositions to having it in-house as opposed to outsourcing it. And I really do feel like we do that best because we understand, like, we're built for the advisor. We don't work with anyone just off the street. We understand the workflow of the advisor. We understand what drives them, how important their client relationships are to them. So we understand that, and we want to position the advisor as the hero. We don't want the credit. A lot of times clients don't even know that they're working with some third party. They just think that we're like the in-house healthcare experts at the firm, and the credit is given to the advisor and the firm. And that is the ideal outcome for us. We want to make sure that clients are attributing the service to the firm and not to us.
So walk me through what a day-to-day interaction on the platform would look like from an advisor perspective. And can you share any success stories about how an advisor has utilized the Caribou platform to ultimately help a client?
Yeah. So those life events that I was kind of rattling off earlier, that's typically the trigger point, right? So there's something that's happening in the client's lives, whether it's turning 26 or turning 25, or it's a retirement, COBRA expiring, or even being widowed or going through a divorce. Like, those are all life events where something happens to the client. Hopefully there's some type of lead up time where you can help them plan proactively. So even though we've gotten these calls of my Cobra expired yesterday. Hopefully you're starting to track these life events in your CRM as an advisor, and you're able to contact that client, 4 months in advance of that expiration date. But sometimes things do happen very suddenly. And in those cases, we're definitely positioned to help. But something's happening. What the advisor does is they would simply create their client an account on our system, name, email, phone number. That's all they need to input, and then they send their client an invitation. So we've chosen, to your earlier comment, Shannon, about like how there's so many different things that advisors need to focus on and consolidating that and integrating it. We've actually built a standalone platform, but it's intentional because we don't want the advisor to be responsible for collecting clients' medications, doctors, or any of that information, nor do we want that data to be synced across their CRM or financial planning tools. There's really no benefit to that. What they want is they just want the output and the numbers and to understand what choice their clients are making. So that's why we've built a standalone platform. So the client will fill out a profile at home on their own. The advisor is not involved in collecting any of that information. When the client submits their information, though, and the analysis is produced, that's where the advisors loop back in. So the advisor's notified, results are ready, it's time to book a call with Caribou. We're going to walk your client through the results, answer any health-specific questions or insurance-related questions that they have, help them make a decision. But again, we encourage the advisor to join that call in the event that there's some financial information or just better understanding what your clients are going to spend. That way you get that output and you can modify your financial plan accordingly. So we have that kind of 4-step process of advisor invites the client, client fills out the results or their profile, results are ready, and then a call typically happens and there's notes that are generated. We call them our planning insights. So you can include those planning insights as part of your financial plan, set any key dates like enrollment timelines or anything like that in your CRM. And it all wraps up relatively smoothly. So sometimes we go through that process from start to finish with the client in a week. Sometimes if they're not retiring for a year, it can take maybe a few months for them to just go through all the motions. So it really depends on who we're working with and what their circumstances are.
No, that absolutely makes sense. And look, it wouldn't be a WealthTech podcast in 2024 if I didn't ask about AI in particular. How do you see it changing the healthcare planning space? And are you piloting anything at Caribou?
Yeah, so I think the big piece that we're leveraging AI for is education. So how can we make the analysis, the deliverable that's sent to the advisor and to the client, easier to understand and have them have better resources around, if they don't know what a deductible is or they don't know what an HSA is, do they need to talk to Caribou or can they just figure that out somehow via the platform? So we've been leveraging AI in that type of context of basically explaining the analysis results. So those planning insights that are generated, they basically walk the advisor and the client through the results, key data points, things to focus on, key timelines to focus on. And that's what's actually enabled more and more of our advisors to be kind of self-service with our products. So not a lot of them actually rely on us for those phone calls. Certainly they're available for advisor and client in the event they want to talk to somebody, because a lot of people do want to talk to somebody about their healthcare, just like how they do with their finances. But it does give them at least a lot more education going into those calls and understanding in a personalized way. So not just template for everyone to see what's the difference between original Medicare and Medicare Advantage, but specific to this client, what are the key focus areas that they need to be talking about is how we've been leveraging it, just to make the advisor more confident, more comfortable, give them more context going into a lot of those client conversations.
So I love a good roadmap question too. So I have to ask, what's coming down the pike for Caribou then?
So I mentioned we can support clients at any life stage. Predominantly, we've been focused on the retiree type of client. So these are your either pre-65 retirees or your Medicare eligible folks. For in health insurance speak, that's your marketplace and your Medicare individuals. For anyone under 65 still working or that has retiree benefits, or even for small business owners, we require them to upload their summary of benefits to the platform. We're looking to automate that process and deliver it in the same streamlined fashion that we do for the retiree type of client. Whereas right now, there's some manual efforts that go into supporting that type of client. Not that we aren't happy to do it. We are very, very happy to go through those motions with clients, but just so that we can work with that type of client base at scale and really market to that type of client demographic that advisors do serve, we're looking to fulfill that same kind of automation, AI powered product for those types of clients as well. We work with a lot of, well, mostly individual clients today, but we get asked a lot about group benefits for small business owners a lot of the time because the RIA themselves are a small business and they need help navigating their own benefits. So we're looking forward to being able to support that group space just as well as we do the individual space.
Fantastic. Well, there's certainly a clear vision there. But it is time for segment 2, Christine, of this episode, which is Ask Us Anything, where I've gone out to the social universe and asked them to submit questions they want answered by you. And we certainly had a few folks slide into the DMs this past week. So 2 questions for you to put you in the hot seat.
All right.
First one, Medicare. It's a critical part of healthcare planning. How and when should advisors talk to their clients about it?
Okay, I could give you a 10-minute answer or I could give you a 1-minute answer. I've got multiple variations of this, but it is critical. So to whoever asked this, you're right, it's critical. So when is the easier part of the question? At least 8 to 12 months in advance because they're getting inundated with emails, mails. They're starting to pay attention to the commercials that they see during prime time or during the sports halftime show or whatever it is. So you want to beat the client to potentially going to somebody else for that type of guidance or potentially making a choice without you even knowing what's going on or getting advice from their neighbor or something like that, right? So ideally 8 to 12 months in advance. We actually have a customer of ours that sends out a happy 64th birthday card to all of their clients as a way to beat any other type of marketing that these clients are getting so that they know that the firm is the place to turn to when they're looking for advice as it relates to their Medicare coverage.
That is actually brilliant.
Right?
I love that.
I mean, so simple, but so easy, right? And that's where as healthcare planning is so good. Now we're going to go off tangent, but healthcare planning is so good when it comes to like tailored, personalized marketing techniques and engagement, because how good would that make you feel getting that card? It's not just your generic card that, the office admin sent out. It's, oh, they actually know that I'm, 64 and need to start talking about Medicare. That feels really personalized, right? So anyways, I digress. So, how to do it. You've got a lot of different things that you need to take into consideration. The first is, of course, the original Medicare versus Medicare Advantage discussion with clients. Really, really important that they have that education going into initial enrollment because it's very hard to reverse that decision later on, depending on which type of Medicare you pick. So I won't get into the nuance because that's the 10-minute version of this answer, but really important that you address that, address how their income may or may not change over the coming years and how that will impact their surcharges on Medicare as well. Even get into the strategy of if their Medicare or if their income rather is decreasing, that you can appeal those income surcharges too, and you can be the one to help them with that if that's applicable to your clients, if they're retiring, for example. And then you get into the actual plans themselves. So it's not enough to just say, go enroll in Original Medicare, go enroll in Medicare Advantage, and go talk to whoever to do that. Actually help the client evaluate either the supplemental and Part D plans or the Medicare Advantage plans and make sure that they're getting objective advice around which one is the best one to them. Because again, if you're working with somebody who's commissioned to sell policies, maybe they're not representing the full scope of the market, or maybe they're pushing clients one way rather than the other because it's in their best interest, not your clients.
Well, we'll do a whole other episode and do the 10-minute answer all around Medicare. But no,
I know you're a Swiftie, Shannon. So that's the Taylor's version 10 minutes of All Too Well. Okay. That's a different episode for another time.
Oh man, do I feel seen in this episode being called on the horses, being a Swiftie, but yes, all of it is true. So, one more question for you. Like I said, in the hot seat, in your opinion, is healthcare planning more of a high net worth client concern, or is it truly becoming more democratized?
So I think it has different value propositions depending on the asset class of the client. For the high net worth client, oversight and control is crucial. You want to make sure you're the go-to person for all of your clients' finances because that's a really big relationship that you don't want to risk. And then it becomes about peace of mind as well for them. It's not about the dollars and cents necessarily, although we've worked with clients who are very, very well off and they really do care about the dollars and cents. Maybe that's how they got to where they are. But it's not typically about that. For them, it's peace of mind. And for the advisor, you want to make sure that you have that oversight and control over that client relationship. And so you don't want to risk outsourcing it. For, we call it mass affluent type of individual, or really even somebody in like the $1 to $5 million range, healthcare can be a significant part of their spending. Well, it is one of the top expenses, but it can take up potentially a considerable amount of their savings in retirement. So with them, that optimization piece is really important. If you can save your clients a couple $1,000s every single year, they will be very grateful for it. They will know that you're taking into account all areas of their finances and that you're truly looking out for them. And so really with them, it's more around cost savings and ensuring that it's incorporated into their financial plan in a way that truly reflects what they're going to spend, because that dollar amount does make a difference.
Oh, that makes sense. Well, I appreciate you being put on the spot and your insightful answers in that segment. But we have come to our final one, which is my favorite that I affectionately call stack it or whack it. So I'm going to throw out a few technologies and be warned, they're not always wealth tech related and sometimes just random thoughts, especially if I know you and you tell me if they are worth the hype or not. So stack it being use it, love it, whack it, lose it, hate it. So first one I have for you, Christine, telehealth, virtual doctors, stack it or whack it.
Stack it. If I could add a sentence to it, just make
Oh,
sure
yes.
you've got a primary care provider, coordinating the background. I'm very bad at this myself, just booking calls with one medical doctors. Every time it's a different doctor, they have got no idea what was wrong with me 6 months ago, a year ago. And so just making sure that's all coordinated through a primary care physician is really important, but absolutely take advantage of the more digital virtual world that we live in, because healthcare is often just so inconvenient, like waiting in a doctor's office, scheduling appointments, waiting amount of months. If you can get them on your phone, love it. Stack it.
And number two, Medicare cost estimator tools, stack or whack them.
Hopefully, if you've listened this far, you know my answer will be whack it, and I'll just leave it at you've got to do better. I mean, that doesn't set you apart from anybody. It doesn't really give your clients any decision-making support, which is what they're really looking at you to help them with when it comes to their finances. So their healthcare is no different. You can do better than just that as an advisor.
Love it. One stack, one whack. I think that's fair. Christine, it's been an absolute pleasure getting to know you and appreciate all your insights today. Please feel free to tell listeners where they can find out more about you and what you're working on at Caribou or any other call to action you would like to share.
Yeah, so our website is caribouwealth.com. Feel free to peruse around. We've got a lot of great education, even things like CE webinars, blog posts, guides, things of that nature. If you want to book a call, you'll probably get me on the other end, so feel free to. You can also find me mostly on LinkedIn. We're also on Twitter, but best place to follow our journey and get updated with education opportunities or what's new with the product would probably be LinkedIn.
Well, there you have it, folks. And be sure to like and subscribe to the WealthStack podcast on all major podcasting platforms and follow all things WealthStack on wealthmanagement.com, LinkedIn, and Twitter or X. I still can't call it X, but I digress. But appreciate your time again, Christine. And thank you all for tuning in.